We talk about the joys and challenges of aging every Saturday morning on the Aging Adventure, brought to you by Legacy Retirement Communities. Thanks for being here with us. I'm Dale Johnson, joined by John Kopetsky and Kathy Blythe. John is the Executive Director of Legacy Terrace at 5700 Fremont Street, and Kathy brings to the conversation her love of the legacy. Good morning, John. Good morning, Kathy.
Good morning, Dale.
Mr. Dale, good morning, sir.
On the show today, Kelly Stenka joins us for a conversation on the Aging Adventure. Kelly is Marketing and Public Relations Director at Legacy Retirement Communities. But today, Kelly is out in front joining us for the conversation about where do I begin? So stay with us for that. But first, on the Aging Adventure, Alicia Jones, Director of Nebraska's State Health Information Assistance Program. Some might know it as SHIP. October, in Alicia's world, means Medicare Part D and open enrollment. Good morning, Alicia.
Good morning, and thank you for having me today.
Alicia, as someone who is approaching age 65, and you're staring at the fact that for the first time in a long time, you're not going to have health insurance provided by your employer, and it's time to look at Medicare. Can you just give us a brief overview of the services that you can provide to people as they navigate the transition into Medicare?
Absolutely. And the good news out there is I know this can be a scary time to approach that Medicare age, and we're here to help you with that. So what we do at SHIP, the reason, we exist is that Medicare itself doesn't have any local offices. You can't actually go into a Medicare office, sit down, and talk about your insurance. So because of that, there's a program in every state. Most of us are called SHIPs that offer free, unbiased Medicare education. And we are really here to help you with anything Medicare related. That could be, the situation we just talked about. You're going to be new to Medicare and you want to know where to start. It could be you need to review options for next year, or maybe you had a service and Medicare denied that bill. We can help you with those appeal processes. So really any questions or any issues you might have about Medicare, we are your local organization to help you through those processes.
Who qualifies for Medicare?
That is a good question, and a question actually a lot of people don't know the full answer to. So typically when we think about Medicare, we think it's for people once you reach a certain age, and that's most people on Medicare. Typically, a person gets their Medicare benefits or is eligible for them when they turn 65. But we actually have two other groups who can get Medicare. We have people who are under the age of 65 who are receiving Social Security disability, and they also can get Medicare benefits. And the last group and smallest group are people with end-stage renal disease or permanent kidney failure. So really belonging to one of those three groups is what makes you eligible for Medicare benefits.
So how far in advance, if someone is approaching maybe that 65th birthday, do you need a year to sign up for it? Do you need a month? Do you wait till your 65th birthday? How does that work?
Well, what I would like you to do is not wait until your 65th birthday. We do get those phone calls, though. Best time frame that a person can use is 3 months in advance. So if your birthday is in October, we want you to start 3 months before that. Give us a call and we'll help you walk through that process.
And of course, we're going to be getting into more detail about Medicare Part D, but why don't you just give us a quick overview of what all the parts are? Is it A, B, C, D? Am I right about that?
You are correct. So in the Medicare world, and when I want people to remember about Medicare is it's health insurance. So it's going to cover the same things that your insurance covered before you went on Medicare. But Medicare breaks it into different parts. So we've got Medicare Part A, Medicare Part B, Medicare Part C and D. We also have Medicare supplements. So each one of them covers something unique, but as a package, you're going to get the exact same coverage that you have prior to Medicare. Same hospital, doctors, prescription coverage.
So what does Part A cover? I mean, can you break down what each of those is?
Absolutely. So Medicare Part A is what we call the hospital coverage, and it covers inpatient hospital stays. Medicare Part B is the outpatient coverage. And this covers most of the things you're going to have happen: doctor's visits, physical therapy, if you go to the ER, anything you get done as an outpatient, that's going to be covered by Part B. Medicare D is the drug portion of Medicare. So that's the part that's going to help you cover those prescriptions. We also have Part C, which is called Medicare Advantage plans typically. And those are an alternative way to get your Medicare. It covers the hospital, the doctors, and the prescriptions all in one. And you're going to get those from an insurance company.
When I hear about them, you see Medicare supplements advertised on television. I'm thinking of Joe Namath promoting one of them, among others. What are those plans and how do they fit into Medicare?
Absolutely. So what you're usually seeing on the TV commercials, and Joe Namath is our favorite one here in the office, those are usually the Medicare Advantage plans you're seeing advertised. So what is being advertised is the Medicare option that is provided by private health insurance coverage companies. And typically they'll offer extra benefits like dental, vision, maybe even gym memberships. But those are going to be Medicare from insurance companies.
Good to know that. And we have lots more to come as we delve into the world of Medicare and specifically more about Part D when we return on The Aging Adventure. Our guest today is Alicia Jones from the SHIP program, and we'll have more in a moment.
Thanks for staying with us this morning on KFOR FM 103.3, 1240 AM for The Aging Adventure, brought to you by Legacy Retirement Communities. Joining me for the conversation, as always, is John and Kathy. Our guest today on the subject of Medicare is Alicia Jones with Nebraska's Healthcare Information Assistance Program. You might know it as SHIP.
Alicia, before the break, we talked about what are the different parts of Medicaid, kind of gave some definitions. Medicare, rather. Can you contrast for me the difference between Medicare and Medicaid?
Absolutely. And I will tell you, those are two programs that people do get confused with each other often. The names are similar and they're both health insurance programs. So we do have both Medicare and Medicaid. With Medicare, in order to qualify for it, you need to be 65 and older, or disabled, or have end-stage renal disease. There are no income guidelines when it comes to Medicare. So it does not matter your income, it just matters you fit into one of those three groups. Now, Medicaid works the opposite way. With Medicaid, it is specifically a program for low-income and low-asset individuals or families. So Medicare does not carry your income. Medicaid, your income is what's going to make you qualify. But after that, they are both, insurance programs. So they're going to offer you health insurance.
So Bill Gates will qualify for Medicare, but probably not Medicaid.
I would say that's a safe assumption.
Okay.
Thank you for clarifying that. Alicia, how can our listeners on Medicare utilize the different SHIP volunteer services that you have to help them make informed decisions, especially about their prescription drug coverage, because we're entering that period?
You're right. So we are about a week away from Medicare open enrollment to start. So open enrollment is the time when people who are already on Medicare have the option to review their prescription drug or their Medicare Advantage options. And there are a lot of options out there, and it can be confusing and sometimes overwhelming to go through those on your own. So my best advice for you is to give us a call. We can set you up an appointment with one of our counselors, and you can do it over the phone, or you can come into the office and sit down with someone, and we will go over those plans with you, do a comparison so that you know which option is going to be the best for next year.
And I used this service myself last year and wondered why I hadn't done it sooner. But I realized I had been paying much more for my monthly premium than I needed to get just the exact same deal on my prescription. So it was very enlightening, and your volunteers are so well versed, and they just cut to the chase and can let you know in short order, what your best top 3 options are. So last year you did it via phone, obviously because of the virus. This year you offer the phone option, but also Zoom or in person.
So this year we're going to be doing phone options, and we're going to be doing in-person options. So if you are in Lincoln, we have 2 office locations, one in North Lincoln, one in South Lincoln, where you can actually come in with an appointment and we'll go over those options with you.
And I'll jump in here and just sing the praises of the volunteers with SHIP. We have a resident here at Legacy Terrace who is a longtime SHIP volunteer and is the go-to person for everybody in the building who wants to review their Part D plans. And she kept detailed lists last year, and there's so many variables between the programs on what the cost is and what they cover. And if you're on medication A, then plan B might be better. But if you're not on that, plan A might, there's just so many variations. And I think Bobby, our volunteer last year, saved residents here something like $100,000 in premium costs for the year 2021. I know one person alone saved like $10,000 by switching their plan based on the medications they have. So it can mean a ton of difference financially.
It's so many people get into that deal that they just let it roll over, which is what it will do if you don't take any action, and they let it roll over from year to year and don't realize the savings that could be available.
Absolutely. And I will tell you, we have one pretty popular plan that over the last 2 years has increased premiums over $40 a month. So if you don't check, if you're not doing those comparisons, you don't know that there might be a plan out there that could save you significant money.
What do people need to do if they want to make an appointment?
Absolutely. So if you'd like to make an appointment, just give us a call. Our number is 1-800-234-7119 and hit option 3 for Lincoln. You'll get connected with someone here in our Lincoln office, and we will set you up with either one of those phone appointments or an appointment here in one of our 2 Lincoln locations.
And let's mention your website too.
Absolutely. And our website is DOI, like Department of Insurance, .nebraska.gov/ship. So that was DOI.nebraska.gov/ship.
We have more yet to learn from Alicia Jones, and we'll be back in just a moment on The Aging Adventure, sponsored by the Legacy Retirement Communities.
Few minutes left on The Aging Adventure, brought to you by Legacy Retirement Communities. We're glad you're with us. I'm Dale Johnson, joined by John and Kathy. Our guest today is Alicia Jones from SHIP, and we're talking all things Medicare today. Alicia and I had a meeting, John and Kathy. I'm not sure if you realize this, but I can see it from here, that Medicare age, and so I scheduled an appointment with Alicia. And one of the things that was frightening to me, Alicia, and you helped alleviate that fear, is the fact that we mentioned penalties. One of them is a penalty that lasts for your entire life. Talk about that.
Medicare does have very specific timeframes in which people need to do things. So I do want to preface this by saying, as you approach 65, you're going to hear a lot about penalties. That is one of the scariest things people think about, when they start getting mailings, when they start talking to friends, is if you don't do this, you're going to be penalized. And that is true. With those specific timeframes, Medicare requires that you sign up for the parts that you need during those timeframes. So Medicare Part B has a penalty. And the way that that's going to work is if you turn 65 and you are not working and you do not have coverage from that employer, you need Part B as soon as you turn 65. Medicare Part D, like drug, also has penalties associated with it. So if you don't sign up for that drug plan right away either, you are going to face a penalty with that. Now, with those penalties, they are lifetime penalties. That means if you miss a deadline, you are going to pay for it as long as you have Medicare in the future. So it is really important that people are paying attention to those deadlines, knowing when they need to sign up, and making sure they're getting their coverage in place. Now, one other thing I want to be specific about for those people who are about to turn 65 is if you're still working and you've got coverage from an employer, you don't necessarily have to sign up for Medicare. You've got employer coverage and you can delay your Medicare until you retire. But anyone else needs Medicare right when they turn 65.
I have a short story to tell. Someone near and dear to me who takes no medications decided, well, I won't need the prescription D plan because I don't take anything. So that went 1 year, and until the enlightenment occurred that you need to have one no matter what you're on. And so there again, that penalty for life, it's not a huge penalty, but it's probably $7 or $8 more a month than would need to be paid forever just by missing that 1 year. So even if you're not on any prescription drug medications at this time, you need to be protected and covered on Part D, correct?
Absolutely. And we do have some Part D plans whose premiums are as low as around $7 a month. So you can pick up coverage that's not going to be very expensive if you're someone who's not taking prescriptions.
I know this is probably a question that we really can't answer, but in general, is it less expensive to have Medicare than what an employer would charge you if you're on an employer plan, or is it more expensive?
John, that's a tricky question. For some employers, Medicare is going to be more expensive. And for other employers, we are seeing really, really big savings for people going on Medicare. And it really depends on what that employer is offering. My best suggestion is 3 months before you turn 65, sit down with us. We'll actually help you compare the two. We'll take that employer coverage versus Medicare, and we'll let you know which one looks like a better deal for you.
Alicia, we hate to have to say goodbye to you, but let's have you give your phone number one more time.
Yes, so if you are looking for assistance with Medicare, especially during open enrollment, please call us at 1-800-234-7119.
Alicia, thank you so much for joining us. I know Medicare is a huge program and an absolutely essential thing for our seniors to have, and we appreciate the assistance you give folks in navigating the waters of something that can be truly, truly scary to embark on. So thank you again. Now we're going to bring in Kelly Stenka, who's the Marketing and PR Director at the Legacy Retirement Communities, and we're going to highlight something we've been involved with here and continue to be involved with. It's Where Do I Begin? Kelly, tell us about that.
I would love to invite any of our listeners to our next Where Do I Begin learning presentation coming up on Tuesday, October 12th, beginning at 1:30 p.m. at our Legacy Estates location located at 72nd and Van Dorn Street in Lincoln. And this program is meant for anybody who's curious about learning about retirement living. If you have questions, it's just a great way to start gathering information if you've had it on your mind and you just simply do not know where to begin.
Tell people what to expect if they come for those couple hours.
Typically, I think a lot of people want the tour. They want to know the prices and all that great stuff, which we will absolutely do. But we're also going to dive a little deeper than that too, because there's a lot of unknowns. And our hope is to always offer perspective that ultimately allows you to gain new insight about, how you personally approach retirement living in general, and maybe needing more cares for you or a loved one, and just how you can age confidently. So not only are you going to learn about all the ins and outs that a retirement living community can offer you, but you're going to feel really good about your personal values too coming out of this, and how that will really benefit you in conjunction with living in a community setting.
Ellie, I know we recently had a Where Do I Begin seminar here at Legacy Terrace, and one of the great things in meeting all those fine folks was they all got some of Chef Paula's homemade pie, and it was absolutely spectacular. So good information and a good piece of pie as well, or some wonderful snack while you're there. Kelly, thank you so much for joining us today. And Where Do I Begin is when and where again?
One more time, the Where Do I Begin is Tuesday, October 12th, beginning at 1:30 p.m. at our Legacy Estates location on 72nd and Van Dorn Street.
And people can register either on your website or give a call.
Yep. So you can visit us at legacyretirement.com/where do I begin to register, or you can call 402-436-3000.
Thank you, Kelly. And we also want to thank Alicia Jones from SHIP talking about Medicare. John, how does someone reach you at Legacy Terrace?
402-464-5700. Love to hear from you.
Kathy, thank you. We'll talk next week. This is Dale Johnson on The Aging Adventure, brought to you by Legacy Retirement Communities.